all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
Hello dear friends, good evening. We are back with yet another episode of BMC Global Live Al Hilal Health World, nothing but lifestyle. In this talk show, we bring before you an expert doctor from Al Hilal Hospital to discuss your various health related queries and concerns. Stroke is a life-threatening condition that happens when a part of your brain does not get enough blood flow. To discuss about this topic in detail, we have with us Dr. Amal Ghosh Uttaman from Al Hilal Hospital, Hamedtown. He is a consultant in internal medicine and he comes with an experience of more than 13 years. So doctor, welcome to the show.
Thank you.
And we are glad to have you with us today.
Thank you for giving me this opportunity.
It's a pleasure, doctor.
Yeah.
So doctor, now we are going to discuss about stroke.
Yes.
So what is stroke? Please explain for us in detail.
Yes. Stroke, in other words, it is called brain attack. Exactly similar to heart attack. What is happening in heart attack, same thing happening in the brain. That is called brain attack or cerebrovascular accident in medical terms. So stroke can be of two types. One is a part of the brain is cut short from the blood supply. That area can get necrosed and can get damaged as the time passes. That is called ischemic type of stroke. Another type of stroke is hemorrhagic stroke, in which a blood vessel can get ruptured and can bleed into the brain matter. That can result in a stroke. That is called hemorrhagic stroke. So basically this stroke means a brain attack which can be of two types. One is an ischemic type, other one is a hemorrhagic type, depending on the type of involvement of the blood vessels.
Okay. So doctor, what are the warning signs and signals found for the stroke? I mean, what are the symptoms? How
Okay.
can we recognize that stroke is about to happen?
Okay. There may or may not be any symptoms. The symptoms can be pneumonized as B fast. B fast. That means sudden onset of any problem in the balancing. That patient is not steady in his gait. Or sudden onset of B. E. E means eye signs. Sudden onset of any blurring of vision, any visual disturbances. And F stands for face. Any abnormality in your face, in your smile, any deviation of angle of mouth while observation. Then comes A, arm weakness. So if you are having any weakness of any of your limbs, basically upper limbs or lower limbs, then you are feeling difficulty in holding some objects, sudden onset. Then S, speech, any speech abnormality, sudden onset of any speech abnormalities. That is, patient may not be able to comprehend what you are saying. He is not understanding. So all of a sudden, he is not able to understand what you are saying, or patient is not able to speak well. Whatever he want to express, he is not able to speak well. Like that, speech abnormalities. Then comes time. Time is very important in the management of stroke.
Okay, now we mentioned about the time. We know that there's a golden time for the treatment of stroke. Can you explain that?
Yes. The golden period of treatment of stroke is very important because patient have to be produced with a facility for all the treatment for stroke within a specified time, that is 3 to 4.5 hours. That is the golden period for the management of stroke. When the patient was found normally last time, till the patient reaches hospital. If that time period is within 4.5 hours, we can offer the initial treatment. If there is no contraindication, you can go for thrombolytic therapy. That is, you will be dissolving that blood clot with a medicine, with a drug, IV drug. That is, usually we use tissue plasminogen activator. That is, Altiplase or Tenecteplase are the drugs which are used routinely within 4.5 hours. But there is no evidence of any benefit after the 4.5 hours. That is why it is called the golden period. You have to reach the hospital within 4.5 hours for the initial treatment. And there is subsequent treatment up to 24 hours. That is a catheter-based mechanical thrombectomy that can be offered up to 6 hours. But nowadays it is being done up to 24 hours. Those two are the emergency treatment for the stroke.
Okay. So doctor, what are the possible causes of stroke?
Yes. It is a complication of lifestyle diseases like hypertension, that is high blood pressure. If it is not under control for a long time, it can lead to stroke. Second most important disease, means lifestyle disease, is the diabetes. If the diabetes is not controlled for a long period, it can lead to stroke. Third most important is the cholesterol level. That is, bad cholesterol level is, if it is high for a long period, that can also lead to stroke. Then habits, certain habits like smoking. Smoking can lead to stroke. Also, heavy consumption of alcohol and caffeine can lead to stroke. Also, sedentary lifestyle, that is without any exercise, simply sitting somewhere and leading life can also lead to stroke.
So doctor, another common question is, can we prevent stroke?
Yes, we can prevent because by preventing these lifestyle diseases like hypertension, you have to seek a specialist consultation, and you have to get your blood pressure under control, you have to get your blood sugar under control, and you have to get your cholesterol, bad cholesterol under control. Then you have to do regular exercise, aerobic exercise, at least 30 minutes for 5 days a week. You have to do regular exercise, and also to maintain a healthy diet. Diet is also very important because you should avoid added salt if you are having hypertension. You should be having a healthy diet style. Then also you have to maintain an adequate weight also, because obesity also can predispose to lifestyle diseases. So you have to maintain a proper weight also. Then avoid bad habits like smoking and heavy alcoholism. By that you can almost prevent stroke for a period.
all your favorite products under one roof in Bahrain from our 14 branches at 27-year-old Megamart and Macromart. Bakery, fresh meat and fish, fruits and vegetables, sweets and snacks, ready-to-eat foods, dairy products, grocery or consumer goods. To have a wonderful shopping experience, please visit your nearest Megamart Macromart branch. Megamart and Macromart, full of goodness.
So doctor, does heredity play a role in the occurrence of stroke?
As such, we cannot say it is a hereditary, but the lifestyle diseases which I mentioned before, like hypertension, diabetes, hypercholesterolemia, can run in families. So in that way, if you are speaking, there is a risk factor for the hereditary factor also for the development of stroke. And
so doctor, does age play a role in the occurrence of stroke?
yes, it is a disease of elderly. Previously, as I could say, it was a disease of elderly, that is more than 60-65 years. But nowadays, strokes are common in youngsters also, because of the with this lifestyle factors like sedentary habits and underlying cardiac issues like abnormality in rhythm abnormalities of the heart, like atrial fibrillation or coronary artery disease or valvular heart disease. All those can throw an embolus to the brain circulation and can develop stroke. Also, many connective tissue disorders can also predispose to stroke. So nowadays, stroke can occur at any age, but usually it is more common in the elderly.
Okay. Doctor, you already mentioned about some of the treatment options. Can you make it more clear for us?
Yeah. As I mentioned before, time is very precious in the management of stroke. You have to reach a hospital where the stroke treatment can be provided within the golden hour. That is most important. And within 4.5 hours, you can have thrombolytic treatment. Before thrombolytic treatment, you have to do non-contrast CT scan. Non-contrast CT scan to rule out hemorrhage, because in hemorrhage this thrombolytic therapy is contraindicated, should not be done. So by doing a non-contrast CT scan, you will be ruling out hemorrhage and you will be giving the tissue plasminogen activator, alteplase or tenecteplase, within 4.5 hours. Once you cross to the 4.5 hours, then you will be subjecting the patient for an MR angiogram, magnetic resonance angiogram. There you will be finding any blood clots in the major vessels. If there is blood clots in the major vessels, there can be a catheter based mechanical thrombectomy up to 6 hours previously. Nowadays it can be considered up to 24 hours. After this, you will be subjecting the patient to a dual antiplatelet therapy. Like one of the agent is aspirin, a second agent is clopidogrel. You can continue the dual antiplatelet for 3 weeks or 3 months depending on the large vessel involvement. If there is large vessel involvement, you have to continue the dual antiplatelets for 3 months. And after 3 months or 3 weeks, depending on the large vessel involvement, you have to continue the single antiplatelet with an atorvastatin for life.
Okay.
For lifelong.
The treatment is for life?
Yeah.
Okay. So doctor, what are the precautions to be taken after the occurrence of stroke?
Precautions, first of all, you have to do the rehabilitation. That can be physiotherapy, that can be speech therapy, that can be occupational therapy. All those physiotherapies has got very important role. And last but not least is the mental support and social support. So you should not neglect a stroke patient. You should encourage them. You should give moral support for them. You should be compassionate for them. That is the most important thing, along with this rehabilitation procedures.
So now what are the lifestyle modifications we can make to prevent the occurrence of stroke?
So as I mentioned, there should be a good control over your hypertension with or without medical management, or diabetic control with or without medical management. But then dyslipidemia also should be brought under control, and you should avoid bad habits like smoking and heavy alcoholism.
So doctor, what is your advice for our viewers regarding stroke?
So it is a modifiable disease, it is a preventable disease. If you have got any lifestyle related diseases like hypertension, diabetes and hypercholesterolemia, you have to consult a specialist, consent specialist, and get it under control, and modify your risk factors like smoking and heavy alcoholism, and there should be an eye on your diet habits. You should avoid any added salt in your diet if you are having hypertension. Also, you maintain a good healthy weight and do regular exercise. By that you can prevent stroke.
So doctor, is there any relation between heart attack and stroke?
Yes, definitely, because the cause, that is etiology, in medical terms it is called etiology, is the same. Because of the atherosclerotic process of the blood vessels, both heart attack and stroke happens. That is why stroke is also called brain attack. Exactly similar to heart attack, same thing happening in the brain. That is atherosclerotic process and plaques is causing the obstruction in the blood vessels, that is leading to both heart attack and stroke. So a heart attack patient is always a candidate for stroke and kidney disease also, unless he is not at all adhering to the proper treatment of the heart attack, or he is not at all adhering to the proper treatment of the stroke. He is a candidate for the issue of the next organ. Like heart attack patient not properly treated can lead to stroke. Exactly similar, stroke patient not properly treated can lead to heart attack also, and both can lead to kidney disease also. So all are having similar etiology, and everything is correlated. Unless you stick on to the proper treatment, you can develop any other complications.
And finally, what do you have to say about Al Hilal Healthcare? What are the services you offer at your Hamilton branch?
Yes, Al Hilal is one of the greatest, fastest growing healthcare groups in Bahrain, and right now we are having 10 outlets, 10 hospitals all over Bahrain, and we have got our neurologists and we have got our physicians. So we are a well trained and well trained team for management of any health related issues, especially stroke. We at Hamilton branch, two physicians are available. I am available from 2 o'clock till 10 o'clock all the day except Thursday. If you have got any lifestyle related diseases, any uncontrolled these lifestyle diseases, you can very well approach to our Hamilton branch. We are very happy to help you.
So thank you, doctor. Thank you for joining us and giving us a lot of valuable information about stroke.
Okay, thank you so much.
Thank you once again. So viewers, I hope this was a very informative episode. For more informative episodes, tune into BMC Global Live Al Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time, this is Jasila Mujib signing off. Good night.